Fevers in kids is inevitable, and at some point they will get sick and run a fever. How to treat fevers and when to worry and what to look out for if your child has a fever. That's what this video is all about. Let's get right to it. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician who takes an integrative and holistic approach to your child's health by addressing the root of the problem. I see thousands of families like you who want more than a band-aid to cover their child's health issues. Now, fever by American Academy of Pediatrics is defined as temperature over 100.4 degrees Fahrenheit or higher. It is normal for your child's body temperature to vary regularly from low to high, but sometimes from being in a warm place or from overdressing, your child's body temperature can run a bit higher than normal, but it doesn't always indicate that your child is getting sick. Sometimes you also may find that your child's body temperature can run low too, from being cold, tired, or even sick. This is to say, it is important for parents to know what your child's normal temperature range is, so that when he or she is out of range, you would know that something may be off. What temperature is dangerous for my child? Now, this is a question I get asked often, and it is because we are worried that high fevers can be dangerous or signify that something serious is going on. The truth is, it is difficult to judge based on the temperature how severe the illness is. Both viral infections like common colds and bacterial infections like ear infections can cause fevers. Some common viral infections can cause high spikes in temperature ranging from 103 to 104 degrees Fahrenheit. These fevers usually don't stay persistently high and will wax and wane on their own. Whereas bacterial infections like ear infections, pneumonia, urinary tract infections, strep throat infections can cause more persistent fevers that last over several days. You may find that fevers in these cases only go down while taking a medication to bring the fever down, and then the fever will come back once the medication wears off. So there's no certain number or high temperature that is truly telling whether something bad is happening. So the most important thing to consider when your child has a fever is to look at how he or she is looking overall. For instance, how active is your child? Is he or she still playing? Is she still eating? Is she still drinking fluids? Everyone reacts differently to fevers and to illnesses. Some kids would run and play despite having a really high fever of 102 and 103, whereas some kids will want to just lay down and rest even with a low-grade fever of 100.8 or so. If at any point your child is acting unwell, pause, encourage fluids, rest, and check the temperature, and treat the fever if there is one. This gets us to the next topic, how to treat a fever. Without medications, you can do several things to help bring the body temperature down. You can give a lukewarm bath, use cold towels and place them on the neck, armpits, and forehead. Dress your child in light clothes and not overdress them. A light blanket may also be helpful. If your child is having fever and acting unwell despite these initial interventions, try an over-the-counter medication like ibuprofen or acetaminophen. These are two different types of medication that helps with bringing down the body temperature. And they are processed differently by the body, so they are generally not to be used indiscriminately. Acetaminophen can be given every 4 to 6 hours as needed, and ibuprofen generally can be given every 6 to 8 hours. You can find the medication dosing chart for these medicines actually on our website, www.littlerootspeds.com, to get the safe dosing guidance for your child based on his or her body weight. Now, a quick note about how to check your child's temperature. In infants, a rectal thermometer will give you the most accurate temperature. In older kids, you can use an infrared or digital thermometer. There are some caveats, however. Number one, these devices will give you different temperatures with different readings, even though you might be taking it at the same place. Number two, temperatures taken at different body parts will vary depending on where it is taken. You will get the most accurate, the highest internal temperature by taking a rectal temperature. But under the tongue, foreheads, and armpits will also give you readings, but those readings will be slightly lower than the rectal thermometer. Again, it's not so much about the actual number, but what it's higher than your child's normal temperature range that is the key. Use your preferred method for temperature taking consistently, and by doing so and in time, you will know when things are out of the norm for your child. By the way, if you found this information useful, please click like and hit the subscribe button so you can be notified for future videos. Lastly, I want to talk about when your child should see the doctor for fever. Fevers are common in children, but it isn't always dangerous. Common childhood illnesses may cause fevers for 2 to 3 days and resolve on its own. As a holistic pediatrician, I believe your child's overall state of health is important to consider. If the fever is over 4 to 5 days and persistent, if your child appears fatigued and not acting like himself or herself, if your child is not drinking fluids or making less frequent pees, if your child has any respiratory distress or rapid breathing. These are all symptoms that would warrant a closer medical evaluation. Fever is a natural response to an infection, but if it is persistent for over 5 days or associated with other symptoms where your child may be dehydrated or having difficulty breathing, you will want to contact your pediatrician for a closer evaluation. Thank you for tuning in, and I hope you walk away with better understanding of this common pediatric issue at the root of the problem. At my Las Vegas pediatric practice, my team and I take a holistic, personalized approach to your child's health. Check out our website at www.littlerootspeds.com for lots of free resources and blogs about holistic care and how we can work together.